Number 3, 003.
I'm in limbo. I am unable to work. I filed for Social Security. I've got to wait for the process. And in the meantime, I can't get any assistance. I start crying when I think about this because I say to myself, I worked hard all my life. And here I am, I can't work. And I can't get any help. I can't get any medical. There's got to be something, somewhere, somebody.
We also treat thousands of people that are really Medicaid patients or they're Medicaid eligible throughout the United States.
I lost my insurance, and now I have nothing. And even with the Affordable Care Act, I can't afford the monthly payments on the insurance. But in the state of Florida, I don't qualify for Medicaid, so I'm left with nothing.
You know, some people say, oh, it's only $12. Well, I don't have $12. I literally do not.
Do you need tickets? Do you?
Is that going to make a difference?
No, ma'am. Sorry. It's first come, first served.
I'm not working because I don't want to work. I'm not working because I can't physically work.
And they cut me from here to here. They went in and took the part that was collapsed out, put the titanium in, and put all my innards back together and sewed me up. And so I haven't been able to work. I've been fighting to get some help, SSD, for 6 years.
My daughter's in college, so anytime I do have money, it honestly goes right back out the door to the college. But I'm grateful these people are here, and hopefully we'll get Medicaid expansion in the state. There's a lot of people here who need it.
Okay, so at 6 o'clock, they're going to call you down to the big tent. Wait for your number to be called, then you can get your procedure done, and park on the left.
Everyone should be provided with adequate health care. You know, whether you're rich or living on the streets, your health is the most important thing, and that should be taken care of.
And I never thought that I would be in this position, but I am.
I pay out of my pocket for my medications. I pay out of my pocket for the one doctor that I can afford, and he works with me so that I only see him every 3 months, so that I can save in 3 months' time to get to see him.
This for me is really, really important. And I don't know what I'd do if they weren't here. My teeth are in desperate shape right now.
Now, we have a wonderful a group of medical doctors here providing women's health, pap smears, mammograms, and diabetic care and all of those important treatments. But the focus of the patients when they come in the door is got to get my teeth fixed, got to get my eyes fixed.
Yeah.
Is it,
Nobody wants this. Nobody wants this. There's not one person out here that wants this. And it hurts. It hurts.
And it makes me angry, and it makes me scared. Oh, no one asks to be poor, but to be punished because of it and to be looked down on. To go through that every day and to hear someone call you lazy or to blame you for your economic position and judge you by it as less than them. it becomes intolerable.
I get really emotional because it's hard. And as a matter of fact, you know what's more scary? That I'm 59 years old. And I know that my body is getting old. It's deteriorating at some point. And I don't have a way to attempt to fix it.
Well, the glasses themselves are a little embarrassing. Look at that.
Being
See
provided
the cracked lens?
free medical care and free dental or vision care. And for many people, they've been lined up since midnight.
It's not about not wanting to do. We need somebody to listen and really be for us.
You must be in your vehicle or buy your vehicle to receive a ticket.
How you doing? Good. One. Good to go. Good to go. Look like one.
Number 15. It's my birthday.
One or two? Two.
Good. 'Cause that means that I'm gonna get in pretty early, I would think. So I'm pretty happy.
How many's in there?
Oh. Golden ticket. 208.
Tooth I have to have pulled. A couple of the fillings I have to have. Glasses for reading my Bible.
The vast majority of people that are here today are people that are falling in the coverage gap. The coverage gap is a space where people who make too much money to qualify for Medicaid and yet not enough money to qualify for purchasing private health insurance on the federal exchange. And so these people have no other option but to access care in this fashion. For many of these people, this may be the first time that they're seeing a dentist or an optometrist or even a medical doctor in years.
And the affordability of my medications, and it's hard. I have to spread it out. My neighbors are great too because they know what kind of situation I'm in. So they bring me all their cans and I save those, crush them, and I take them every month and it pays for 2 of my medications. So, and just keep trying and trying to get this insurance and get up on my feet somewhat. I can't go back to work. My days are so inconsistent. And nobody asked for this.
That the Florida legislature needs to listen to Floridians. Over 60% of Floridians support the expansion of Medicaid. And we know that this is a win-win for our state in terms of a financial win, and we know it's going to save lives.
As our elected representatives, you can't afford to take into consideration that if you provide people with health care, they'll be able to work. That if you help someone to be able to take care of themselves and lead a productive life, we actually put money back into the economy. We're real people. We're real people just trying to get by. It's not about your party and it's not about your politics. It's about the people in your state and your sworn duty to care for us as our elected representatives.
I hope a lot of things change. More people need to speak up.
If you're here to see the dentist, please raise your hand. 1 or 2 people.
The vast majority of people that are here today are people that are falling in the coverage gap. The coverage gap is a space where people who make too much money to qualify for Medicaid and yet not enough money to qualify for purchasing private health insurance on the federal exchange. And so these people have no other option but to access care in this fashion. For many of these people, this may be the first time that they're seeing a dentist or an optometrist or even a medical doctor in years.
Children in the United States do receive in large part the services that they require. But after they come out from underneath that umbrella of protection, unless they're from a well-to-do family and the family is well insured or they can afford the insurance, then by the time that they transition now from the school age to their 30s and their 40s, which is really the profile of most of the patients that come here, they're starting to get problems with their teeth because they weren't able to look after them, and their vision is perhaps starting to need correction.
Preventive care aspect, people who are just finding out they're diabetic or finding out they're hypertensive, things that are going to change their life expectancy over the next 10 or 20 years. And at least if we can get them started on the right foot to getting care, that the emergency room won't be their entry to setting when it's really a problem. Yeah.
You have a mouthful of bad teeth and the infection starting to run through your body. It leads to all kinds of other problems. In fact, before the age of penicillin, it was one of the leading causes of death from infection from bad teeth. And it still does cause death in this country to more than just a few people. So it also leads to diabetes and heart disease. So oral health is probably, you might say, the sort of cornerstone of good health.
I think it's a couple of people are coming back that were here with me last night. They did a good job. He had to stitch me up, and he had a little hard time going into my mouth. Yeah.
Okay, don't cry.
I was just so happy. I was telling these not tears of pain and hurt. It's just that I'm finally here, So I'm going to tell anybody if they see this, there is hope. There is somebody that cares enough about people that can't afford health care.
316.
The government needs to get on top of that game. They need to do something. And do it quick. It's time. It's time.